Thank you, Dan. Intermountain Medical Center has announced a new cutting-edge 3-year study to determine if a blood test could detect DNA from breast cancer tumors. And here to explain is Dr. Brett Parkinson, Intermountain Medical Center Breast Care Center. Always great to have you here. We, in fact, talked on Monday about this same topic. This could be fascinating. A simple blood draw at the doctor's office could potentially determine if you have breast cancer. That's what we are trying to find out.
That's what we are investigating. The concept is this. We know that women who have breast cancer have little fragments of DNA that break off the tumor and they circulate in the blood. The question is when are they detectable? So the test we're doing at Intermountain is looking at the blood of women who have known breast cancer and comparing it to blood of women who are being screened for breast cancer who are asymptomatic. And then we'll compare the blood samples and see if any of those in the screening group have any fragments that can be detected. And if they do, that could change the way that we screen for breast cancer.
And doctor, we actually, when we did the story, everyone did it, and we thought, oh, we would have to convince women to get the blood draw. Actually, you have to do it twice, once before mammography and then second and after. But now you're getting calls of women wanting to get tested.
Right. What we had planned to do was tell women when they called for their screening appointment that there was a study available that they could participate in. What happened is as soon as we had the press conference, women started to call saying, I would really like to be part of the study. I mean, this is altruism coming out, because what it entails is a blood draw, which is a little bit uncomfortable, but we have been delighted that so many women want to step up and be part of this project.
So a 3-year study, and could you see one day that we would go into the doctor's office and actually have the mammogram be the supplemental after being tested from the blood draw?
You know, it's possible. We know that with mammography, we miss some breast cancers, particularly in women who are younger, who are premenopausal, who have dense breast tissue, which can obscure small tumors. Well, we know that if we could find those tumors earlier, say with the blood test, that we could find those cancers at an earlier, more treatable stage, and that's what we want to do. So mammography may not go away, but it may be supplemented with this test, and who knows, in 15, 20 years, we may simply have a blood test, and if it's positive, then women will undergo mammography and other imaging to see where the tumor is so it can be treated.
And we can't forget, we've run out of time, but early detection does save lives. We cannot stress enough, mammograms is a must every year starting at age 40. Thank you so much. We'll have all that information on our website at goodforutah.com.